Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast. I'm Jill Melby with the Here's to Your Health podcast. Today I have Dr. Ranniger with me, and we're going to talk about ear infections. So can you just introduce yourself to them?
Yeah, absolutely. My name's Dr. Elizabeth Ranniger. I'm a pediatrician here at Crawford County Hospital.
Thank you. So I know it's ENT month, Kids ENT month. So what are some of the most common symptoms of an ear infection in children?
So typically symptoms of ear infections can vary kind of by age. So the younger children aren't going to be able to tell you quite as much, but fussiness, crying, a lot of times parents will come in and say they just haven't been themselves. So that's probably the most common thing. And then babies a lot of times will dig at their ears or pull at their ears and kind of rub them. Fevers can be a common symptom, and then like decreased appetite, not sleeping quite as well, that kind of thing. But then as you get older, a lot of times they can just say, you know, my right ear hurts, which is so nice.
Right?
We like that.
Yes. Then you can kind of pinpoint things that are going on.
Correct.
So when should parents be concerned enough to call the pediatrician or seek care?
Right. So many ear infections can be pretty mild and can honestly just resolve on their own. Big indications to come in would be if your kid is having severe pain, if it's waking them up from sleep. A lot of times that will be something that parents will bring them in for. Worsening over a few days, if like the kid starts complaining on Monday and it's kind of intermittent at that point, and then a couple days later they're saying it again and it's getting worse, then I would bring them in. So.
Very good.
Yeah.
So I know a lot of kids sometimes get them frequently.
Yes.
Or, you know, one right after another. So what does frequent mean? Like how many is frequent?
So there's different definitions of frequent, but the frequency that we talk about is more the indications for when they would get ear tubes. So basically if you would have 3 or more in 6 months, 3 or more ear infections in 6 months, or 4 or more ear infections in 12 months, that's when we would get a little bit more concerned that maybe we need to do something else besides just treating with antibiotics every time they get sick kind of thing.
Okay, so then what do the ear tubes actually do? Like how does that work?
Yes, so ear tubes are basically just a tiny little tube, looks like a tiny little toilet paper tube that goes inside your eardrum, through the eardrum, from the canal into the middle ear, and basically just drains any fluid that would accumulate back behind the eardrum. Draining that fluid helps to prevent it from just sitting there and getting infected, and so that can help kids not get ear infections quite as often. Then sometimes the symptoms will change when they do get an ear infection, though. Then they'll get more drainage from their ears. So.
Okay. Gotcha. So what's the most important thing that you want parents to know about ear infections in their children?
Absolutely. So kind of like we talked about before, some ear infections can be mild and they can kind of just be watched at home. But if your kid's getting a lot more sick or just really in a lot of pain, I would have you come in. And then there are other ways that you can kind of prevent ear infections too. So definitely staying away from secondhand smoke as much as possible. Getting your vaccinations on time can help. There's certain vaccinations that actually are for specific bacteria and viruses that trigger ear infections, so that can help prevent those. Breastfeeding can help prevent ear infections, and then bring them in if you have any concerns. We're happy to see them.
Well, thank you so much for giving everyone news about the symptoms and tips about ear infections.
Absolutely. Very common.
Yes.
Thank you so much, Jill.
Yes, you have a great day.
You too.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.